We stay home to save lives, and our efforts are working. On the next Health Matters, we'll talk about what life with coronavirus may look like in the months ahead with the Inland Northwest top health doctor. Also, how Washington State's hospitals have fared, and is the system ready for the predicted second wave? Plus, how WSU handled the challenges of educating medical professionals in the peak of the pandemic. Right now on Health Matters.
Health Matters is made possible with the support of WSU Health Sciences Spokane, WSU College of Medicine, and by Providence Healthcare.
With every twist and shout and every mended heart, we see you. You who trusts us to take care. Providence, health for all, care for you.
Good evening and welcome to Health Matters. I'm Teresa Lukens. Most of us weren't alive when the last major pandemic hit the world, so the COVID-19 coronavirus is new territory for us, and we're learning as we go. We miss our families, our friends, and eating in restaurants, and wearing a mask can be inconvenient and uncomfortable. But all of our sacrifice has minimized the spread of the virus and likely saved lives. Joining us with the latest on the process to move forward is the health officer for Spokane Regional Health District, Dr. Bob Lutz. And Dr. Lutz, what does phase 2 mean?
Teresa, phase 2 means, again, looking at the governor's guidance, phase 2 indicates that there will be certain businesses, certain activities that will be more readily available to community members. And so there will just be a greater, albeit still limited, opening. But, all things moving forward, irrespective of whether it be phase 2 or phase 3, you're still going to have those recommendations in place for, performing physical distancing where available, wearing masks where possible, and of course, lots of hygiene and, hand hygiene, not touching your face, things of that sort.
Mm-hmm. Talk about Spokane County as a whole and where the virus is concerned. The last time you and I spoke, we were just heading into this. People seem to have taken it seriously, flattened the curve, boxed in the virus, a more recent term being used. So how have we done? What's your report card on the county?
Yeah, I think certainly, as you suggested, Teresa, I appreciate the fact that people have taken the sacrifices upon themselves and really work to flatten the curve and to keep us all safe. Our numbers have, again, continued to look good. There have been some concerns, here and there, but I think overall the picture is good. So I think we are definitely in a good place. I feel comfortable at this point with where the healthcare systems are in being able to manage any little surges that might occur. I am, however, concerned about some behaviors that people are taking this kind of maybe a little bit too liberally, a little too soon. And, I've talked about opening the door and opening the door slowly, in that as we open the door and people get back together, we know that getting back together will likely cause more cases. And I really want to ensure that both we in public health and the healthcare system, we're both really able to provide that necessary infrastructure and safety net for our entire community.
Mm-hmm. We can't stop being concerned at this point. Just because we move into phase 2 doesn't mean that we're out of the woods yet.
No, definitely not. Unfortunately, Teresa, we've seen examples in other communities across the country where I would say maybe a more cavalier attitude has taken place. And as a result, we've seen, significant increases in number of cases. And if you're going to get more cases, you're going to get more hospitalizations. If you get more hospitalizations, you're going to get more people dying of COVID-19, which is really unnecessary. So it really is trying to be patient. And I get it. But I mean, there are lives to be lost, and it's a real balance between lives and livelihoods. And it's not easy, but it's really a balance that we have to make.
Are we still short of testing?
It's a great question, and one I get asked pretty much on a daily basis. You may have seen the newspaper article a couple of days ago where the state public health system were sent the 22,000 swabs that looked like Q-tips. I talked with the public health lab director today, and it was not what he had expected. They're running some tests right now to ensure they can use those materials. When I've talked with my colleagues at the healthcare organizations, they say that they have adequate material right now. But again, it's not as if the pipeline is wide open. It's still a challenge. Their supply chains remain somewhat stretched. And so we're good now. But if there's a surge and we go through our materials really quickly, that's of great concern.
And explain again who should be tested at this point.
Yeah, certainly early on, we were much more restrictive with guidance on who should be tested. So we looked for the classic triad of cough, fever, and shortness of breath. We've realized as we've learned more about COVID-19 that the symptoms are really a myriad, from anywhere from no symptoms to significant symptoms. And so a couple of weeks ago, the CDC, Department of Health, and therefore the Health Department liberalized the criteria. So if someone has, again, that classic triad, but also has chills or body aches, they can have gastrointestinal symptoms like diarrhea. They can have new onset of loss of smell or taste. Those are all symptoms that have presented and we've seen with people with COVID-19. So, I still say if it acts like flu, think COVID-19. I think that's a good baseline, but a lot more symptoms are out there now that we're seeing, such as, now we're seeing this inflammatory illness in infants and young people that looks like something called Kawasaki syndrome. To the best of my knowledge, the only case that's been identified in Washington State was in Seattle, but very alarming and totally unexpected from this virus. But we're seeing it now, and we've seen it internationally as well.
And it can come on quite quickly from the sounds of it.
Yeah, very much so. It's the child can be doing well, and then all of a sudden, a very quick turn for the bad. So it's not something we've seen a lot of. It's obviously not something we know a lot about, but we're learning very quickly. But yeah, very untoward side effect of COVID-19.
And as we've gone through the last few months, we're now being encouraged to wear our masks in public. Where do you stand? Who should be wearing a mask? And it is in all public places, including outdoors?
Yeah, so, masks, facial coverings, be that what they may, I think, certainly the conversations around masks have changed pretty significantly. And, if you think about science, we've learned a lot about COVID-19 over the past few months. Science tends to start and stop. It tends to go fits and starts in how we understand science. And I think early on, the recommendations were certainly not to wear masks. We were also very concerned about the lack of masks and personal protective equipment for healthcare. There are still challenges in acquiring PPE, but it's better. So what we're encouraging people to do is to wear, the cloth masks, and they, depending upon how well they're made, they may prevent the respiratory particles 60 to 85%, depending upon how the mask is made. And, the message for me is that this is me helping you. This is me doing right by you, because it's going to trap those respiratory particles in the mask, prevent me from infecting you. And if I can prevent you from being infected, and if you can prevent me from being infected, then we're all protecting each other. And I think that's, how we work here in Spokane. That's how we should be working. It's a community effort. It's not just me. It's not just you. It's all of us.
And finally, just a quick final message for Spokane County when it comes to coronavirus and COVID-19. And as we do move forward, what would you say to those that are becoming frustrated?
Patience. And I know it's easier said for some of us than others, and some of us to experience than others, but I really do advocate patience. We want to go forward, not backward. And my sincere concern is that if we become too cavalier with COVID-19, we've seen people's lives lost. We've seen people get very sick, hospitalized, and as I said, die from it. We don't want to go back to the type of restrictions we first saw. And yet, if we have a resurgence, if we have that second wave, which we're very concerned about, we will find ourselves quickly shut down. And so patience, let's take incremental steps, baby steps forwards, and open the door slowly rather than having the door slammed shut on us.
Dr. Lutz, thank you for being with us tonight.
Thank you.
One of the biggest concerns surrounding coronavirus was the possible stress on the hospital system and if there would be enough medical equipment and protective gear for doctors and nurses to treat patients safely. Joining us now is the president and CEO of the Washington State Hospital Association, Cassy Sauer. And Cassy, thank you for being with us.
Thank you so much for having me.
How do things look as of today for the hospital system in the state of Washington?
I think we can all be incredibly proud of our hospitals, our doctors, our nurses, and all Washingtonians for how well we have responded to the coronavirus. We were concerned early on that we might reach a point of system overwhelm, and we never got there. We never even got anywhere close. We were able to treat every patient that came through our doors well, with compassion, and when patients needed to be moved around to different hospitals, that happened easily. So it's really a remarkable story.
So as we move forward and sort of take a pause at this time, what is it that the hospitals will need as we move forward?
Hospitals have been really impacted financially by this work. We canceled, just really aggressively canceled all kinds of elective procedures in anticipation of needing to have plenty of capacity to treat patients with COVID. And so the hospitals lost a lot of revenue from that, and patients, I think, have also had their health has suffered as well. So we want to really quickly get back to business and providing the high quality care to all kinds of patients, and to ensure that hospitals can be financially sound.
And in fact, affected them so much that there are some major financial concerns at this point.
Yeah, I think it's ironic now that we are actually furloughing hospital staff. But the revenue losses have been intense. In most cases, the hospitals are saying that they lost about half their revenue, but their expenses went up because, for example, personal protective equipment, so much more is required for caring for COVID patients, and the prices of it went up so dramatically.
What will that mean for patients?
Well, I think for patients, the core services are definitely being contained, and these are really furloughs right now. And the hope is that the patients who need care will come back. We've done a lot of talking to patients who have delayed care. We've seen a really remarkable and scary, honestly, number of patients who have delayed their care, patients who've had a stroke, who stayed home for several days before they came to the hospital, and they've lost an opportunity for very effective treatment. So I think for patients, we want them to come to the hospital or to their doctor's office or clinic or urgent care, or whatever the right venue is, as soon as they have a health concern, to make sure it's taken care of well. But and hospitals are ready to care. Hospitals are ready to care for them.
So, because there has been a fear about seeking care because of the virus.
Well, I think there's been two things: a fear about seeking care because of the virus, that people could catch coronavirus in the hospital. And those coronavirus patients are very much segmented in the hospital, and hospitals are also experts at infection control. So they really understand how to keep people safe. So that's been one. But the other has been people have heard the message about stay home, don't go anywhere, make sure the hospitals don't get overwhelmed, don't overwhelm the hospitals. So we've heard from patients, I didn't think I was supposed to come. I thought I needed to reserve all the hospital capacity for other patients. And if you're having a stroke or heart attack, or you've broken your leg, or your child has a serious cut, those kinds of things, make sure you're taking care of them.
And that's the critical care piece. What about elective surgeries and procedures?
Yeah, those are just starting. The governor issued a new proclamation on Monday that is allowing those elective procedures to continue. And those are also really important. We've seen a decline in the number of new cancer diagnoses, for example, which sounds like great news. Like it sounds like there is less cancer. We don't think that's the case. We think what the case is there's more undetected cancers from things like colonoscopies or mammograms. So we want people to be getting those regular screenings to identify things like cancer early so they can get treated well.
What kind of stress has the virus had on our rural communities and the hospital systems in the smaller communities? We have a lot of them around the Spokane area.
Yeah, they've definitely been stressed by this. They've seen very few COVID cases, but they also had to cancel under the governor's proclamation all of their non-urgent procedures. And so they, in particular, their ability to serve their community and their financial health was really in danger.
Mm-hmm. One of the upsides, if you will, would be that more telemedicine is being used. Do we anticipate that moving forward even stronger?
Yeah, I think so. I think there's a lot of things that can be done via telemedicine. There also is a lot that is important about having hands-on patients. And so in some cases, I think telemedicine can be an effective treatment ongoing. But I think in other cases, this is a kind of a stopgap until we can really until we can get patients back into the clinics and the hospitals and be able to really take their vital signs and have a face-to-face conversation and feel how they're, really get hands on them, which I think is important too.
A lot of concern about testing and some of the drugs, even in experimental phases being used. There's actually some movement on that front as well.
Yeah, really exciting news. The Gilead company has donated remdesivir to our state. And so we are in the process of helping the state distribute that drug across the state. It's a drug that shows promise for treatment of patients with COVID who are hospitalized. And so some of it's coming to Seattle and some of it's coming to Spokane. And so it will be available to Spokane area and surrounding hospitals as they have COVID patients that are hospitalized, which is really great news.
And where do we stand right now, Cassy, as far as people being able to visit family and friends that are in the hospital? That's been frustrating.
Yeah, it's very limited. And I will say my father was in the hospital during all this. He fell and broke his hip, and we weren't able to visit him. And it's, as a family member, I understand that frustration. It's terrible to not be able to visit someone in the hospital. And on a policy level, I totally supported it. And I know that that's going to continue to be really limited about who can visit. We want to do everything we can to keep patients safe and to reduce transmission. And I think there's more risk. There's actually more risk from visitors coming in out of the hospital than there is from patients who have COVID who are identified in the hospital who are being kept isolated.
And finally, what's your message to our viewers as we do start to move toward the summer months and hopefully continue to progress through the phases?
Yeah, I think it's really a message of gratitude that Washingtonians all pitched in. It's been hard to stay home and hard to be, to limit social encounters. I know it's been tough for everybody. And the fact that we did that and that people took such good care of themselves and especially of their grandparents and people that are vulnerable meant that we didn't get overwhelmed. I mean, you look at how we compare to other states in the country and other countries in the world, it's remarkable that we never reached overwhelm. We were able to care for everyone, and our rate of case transmission and death is very low compared to other places. So I'm just really grateful to all Washingtonians for being so careful.
Well, we will leave it at that. And thank you very much for joining us tonight. And
thank you.
And stay safe.
Thank you. You too. Take care.
Well, doctors and nurses are being hailed as heroes, and rightfully so. Those on the front lines have faced unique challenges, including long hours and a threat to their own health. To say they need relief would be an understatement. But that's a bit of an uphill battle. Even before the pandemic, the Association of American Medical Colleges reported that by the year 2032, there will be a shortage of physicians and nurses numbering into the hundreds of thousands. Joining us now is the founding dean of Washington State University's Elson S. Floyd College of Medicine, Dr. John Tomkowiak. Thank you so much for being with us this evening.
So glad to be here. Thank you, Teresa.
Well, WSU, in part, along with other schools across the country, tasked with training the next generation. How has the pandemic affected that process?
Well, it's been difficult because we've had to pull our students out of clinical rotations while we are all at stay at home. And so we've had to come up with different ways to train our future healthcare practitioners in an environment where they can't interact with real patients. So we've done some amazing things with technology and simulation and are making sure that our students are going to be ready when they can re-enter the clinical environment.
Well, and in fact, by all accounts, Washington State University, the College of Medicine, was a little more prepared than some other schools when this all happened.
Absolutely. We have an electronic platform for all of our students. So when they enter medical school, their entire curriculum is already on an iPad, and they work through that all 4 years. So when we had to transition to online, they already had all their resources and materials at their fingertips wherever they were, so they could easily stay at home and engage in our virtual learning environment.
So now that we're starting to transition back into hopefully phase 2 very soon, what has the experience been like for students to this point?
Well, what I will say is, first of all, they have been amazing in their ability to be flexible and adaptable. And that's exactly the kind of people we need in our future healthcare workforce, because there's going to be more crises like this. There will be other things that they need to adapt and change to. So I've been really grateful that our students have rose to the task. One of the first things we did when the crisis came upon us was we had a whole unit that was focused on COVID and all of the implications of COVID, and got our students up to speed on the pandemic, and so they could understand it when they do re-enter interacting with patients. And as I've said, over the past 2 months, we've continued our curriculum in a virtual fashion. We meet in small groups. Students have been practicing their clinical skills on each other, sometimes with faculty supervision across a Zoom link. And so we hope that sometime in the month of June and July, they'll be able to re-enter taking care of patients, and we feel they're going to be ready to go.
And will that plan look different from what they were accustomed to before the pandemic?
Absolutely. For the safety of not only them, but of the rest of the population, we're going to ask them not to engage in care of patients who have already been identified with COVID. We know that their age group is a primary group to potentially have no symptoms but be carriers of the illness. So we want to protect them and the public. So we're asking them not to do that. They are going to be wearing PPE to protect themselves and patients, and we are going to ask them to follow social distancing rules as well. So it's going to be a little bit of a dance in terms of taking care of patients, but we know the experience is going to be well worth it, and it's going to be what they're going to be doing when they're training in their residency programs and eventually as physicians.
In having conversations with other colleges around the nation, how have those looked, and what type of things are you talking about as far as the entire nation goes in training the next generation?
Well, certainly we've seen some good trends and outcomes because of this crisis. Like for the example of getting payments for telehealth. We know telehealth is going to be so important, not only during this crisis, but for rural and underserved areas. Telehealth is a way that we can really improve access. So if some things come out of this crisis, like payments consistently for telehealth visits, that would be a real plus for all sorts of Americans across the country. We are training our future healthcare practitioners to be really good in that medium, and that's going to be a skill they're going to have going forward. So, we're definitely been challenged by this crisis, but I think it's going to make our healthcare workforce better and more prepared to deal with not only future crises, but deal with vulnerable patient populations.
Mm-hmm. And because there is such a huge need for medical professionals, doctors, nurses, techs, all across the board, do you anticipate that the pandemic will inspire some to go into medicine? Will it be, a conversation that maybe they're on the fence, they're not sure what they should do? How does that look for the future of the medical profession?
Well, that's exactly what we're seeing. And you might think that students might be scared off because of the risks involved, but they seem to understand the risk, and what they're really concerned and excited about is the ability to make a difference and help people who otherwise might not be able to be helped. So we haven't seen any decrease in our applicants to our schools, and we're really heartened by that there is a population of would-be healthcare professionals who really care about the people that they're eventually going to take care of.
Dr. Tomkowiak, the school has been involved in actually treating patients in the area. Can you talk more about that?
Absolutely. We have a homeless triage program where we are testing homeless in and around Spokane for the COVID virus. And if they test positive, either helping them shelter in place or go to the testing grounds where we do have a shelter for them, and we're monitoring them and making sure they're doing well. And we also have another monitoring program with the Spokane Alliance where patients who have been identified as COVID positive but not sick enough to the hospital, we give them O2 saturation monitors, and then we call them at least daily and monitor their symptoms and progress. And if they start to get worse, we can help and intervene, get them to the hospital and the healthcare services. And we've done that at least twice and had really good outcomes. Our students in pharmacy, medicine, and nursing are participating in that monitoring program. So we're really excited about how we can help the community take care of.
So what would be the next step for those that are considering medicine and the Elson S. Floyd College of Medicine?
Well, obviously, you have to do well in school. You have to take some admission tests. But I think what's really important for us, since our mission is focused on rural and underserved, we want to see people helping out in their communities. And to the extent you can get that experience now, that would be awesome. But we also want our applicants to be safe and take care of themselves and others. But one of the things that is important is you understand what you're getting into. So being able to shadow a nurse or a physician and showing that you're invested in your community is a great start.
All right, very good. Thank you so much for joining us, and best of luck as we move forward in training those doctors and nurses that we so desperately need.
Thank you, Teresa.
For more information on tonight's topic, go to ksps.org and click on the Health Matters page. And that will do it for now. Stay healthy and stay safe. Until next time, I'm Teresa Lukens. Good night.
Health Matters is made possible with the support of WSU Health Sciences Spokane, WSU College of Medicine, and by Providence Healthcare.
With every twist and shout, and every mended heart, we see you. You who trusts us to take care. Providence. Health for all. Care for you.